We've talked about anatomical regions, we've talked about anatomical directions. Now it's time to talk about anatomical planes and sections. Planes, in this case, we don't mean the things that fly through the air that have jet engines or propellers. Planes, you can think of, this is like the mathematical concept of a plane. Think of it basically like a big giant sheet of razor-sharp titanium. And what we're going to do is we're going to start cutting up bodies. And every time we cut a body with this giant sheet of razor-sharp titanium, we will create sections. Those of you who are serial killers are probably already familiar with this, but we have to make it formal. So planes are imaginary flat surfaces that divide the body into distinct partitions. Principal planes include the frontal or coronal. Now here's just another example of when there are words that are synonyms here, certainly for humans. Frontal and coronal. So this is where you slice through, basically creating an anterior and a posterior section. So in this one, I wish we were in class so I could show you, but we can't. So the figure on the left, it's that bluish colored plane. That would be the frontal or coronal plane, okay? Then we have the transverse or horizontal. That would be the green plane. Transverse or horizontal planes cut into a superior portion and an inferior portion. So once again, frontal or coronal planes cut the body into anterior and posterior. Transverse or horizontal, they're synonyms, cut the body into superior and inferior. And then sagittal, which would be the yellowish plane, cuts into what you would think, first of all, as left and right. Now we have what's called a mid-sagittal plane that would run through the midline. So it would go right down your nose, right down your sternum. It would separate you into exactly right and left, equal halves. But a parasagittal plane could be further to each side. So for example, we could sever that poor man's right arm. If we were to move that plane closer to the front of the screen and then cut with it, we could sever his right arm from the rest of his body. That would be a parasagittal plane, okay? Sections are the flat surfaces resulting from cuts through the body structures, named for the plane on which the cut is made. This is important because in medical illustrations, they will often tell you what you're looking at. So they will say an inferior section of the liver. All right, that you should know then that you're looking up from underneath on the liver, okay? So take a look at these and see if you can figure. Here are three sections of the brain, all right? See if you can figure out which one of these is coronal or frontal, which one is transverse or horizontal, and which one is sagittal. In this case, it's actually mid-sagittal. So what about that one on the top left? What kind of a plane made that cut? Yeah, that's a coronal plane. What about the one on the top right? Who did that? Which plane did that? Yep, that would be a horizontal plane. And then in the bottom center, which kind of plane made that cut? That's a sagittal plane. Get used to these. Here's an attempt on my part to start getting you familiar. Remember that I said with animals it gets more complicated, four-legged animals. Here you see this kangaroo also has rostral and caudal. We don't do that, cranial and caudal. But you can see it's still basically the same idea, slicing up into planes. So I started you off with a weird example, which doesn't follow all the terms that we use, but here's one that does work. Not exactly, but closer. So here again we see the person with anterior, posterior, ventral, dorsal. Here notice ventral and dorsal mean different things on a dog, don't they? Four-legged animal, it's different. Notice the dog also has cranial and caudal. Here a cat, again, the frontal, sagittal again. So it's the same planes. It's just different terms for four-legged animals. There's a dog. Notice again medial lateral, all right? Ventral dorsal. Notice in this case also proximal distal. So the part of the dog's leg closer to the body is proximal. The part further away is distal. Okay. Notice there are other terms there that dogs have that we don't. You don't have to know those. Fish, same thing. I want to show you here that it really is the same thing for all the different kinds of animals. It's the same planes. It's just they end up with slightly different terms because different animals have different orientations than we do. But look at the terminology here. Look at on the fin, they have the proximodistal axis. You have the distal end of the fin and the proximal end. That's the same. Notice the fish has an anterior and a posterior, just like we do. Has a dorsal and a ventral. Ventral is the belly, dorsal is the back. Horse, again, similar things. Same with a sea lion. Same with a turtle. All right, same basic terminology. Birds, you got another whole set of terms because birds fly. We don't do that, at least not usually. So birds also have the roll axis, the pitch axis, and the yaw axis. Pilots know about those because those are how you maneuver planes. We don't have to know them for this class. But if you're going to take me on a ride in your airplane, I hope you know those terms. Let's move on then to talk about body cavities. What does the word cavity mean? A cavity means a space inside of something. Your body has many spaces in it. The spaces are filled with things, but we still give names to the spaces themselves, all right? Those are the body cavities. Let's take a look. Body cavities are spaces within the body that help protect, separate, and support the internal organs. You don't want everything to just kind of like fall down into a big blob inside of your body. So the cavities help keep things separate. They keep them separated, they keep them supported, and that gives us another way then to talk about where things are. We can say that one particular organ is in the abdominal cavity, whereas another is in the thoracic cavity. These are common terms. You have to get to know them, and you'll be tested on them. So first of all, the two principal body cavities are ventral and dorsal, and we just saw those terms, didn't we? Ventral, also, what's the synonym for ventral? Anterior. What's the synonym for dorsal? Posterior. So we have the front side of the body, the belly side of the body, and the back side of the body. So we have the dorsal and the ventral body cavities. The ventral cavity is composed of many subcavities. So the thoracic cavity, that's what you think of as your chest. But the thoracic cavity also then is divided up into subcavities. So there are the two pleural cavities. Those contain your lungs. They enclose your lungs, is really a better word than contain. So pleural, the root word there means lung, all right? Pleural always refers to lung. And then the mediastinum. Funny looking word, but it's not that bad. Media, in the middle. Stinum, the same root word as sternum. Mediastinum. So this is the cavity right behind your sternum. So in other words, it's in between the two pleural cavities. The pleural cavities have the lung on the right and the left, and then in between the two lungs is the mediastinum. And then deep within the mediastinum is the pericardial cavity. Once again, good root words here. Cardial means heart. Peri, like the perimeter, like a periscope in a submarine. Peri means around. So this is the cavity that goes around the heart. All through this course, and in Bio 202 as well, I keep stressing root words and prefixes and suffixes. The more you master, the easier your life becomes. Sometimes people say, I don't have to learn all that extra stuff. No, you're totally missing the point. If you learn some basic root words, it makes you so much more powerful, and don't we all want to be more powerful? You will be able to understand the meaning of words you've never seen before if you know the root words. So it's a big help. I'm going to stress it a lot. Then we have the abdominopelvic cavity, all right? The abdominopelvic cavity composed of two subcavities. What do you suppose they are? Yeah, the abdominal and the pelvic, right? I mean, what's big and red and eats rocks? A big red rock eater. What makes more noise than a cat stuck in a tree? Two cats stuck in a tree. See, these are simple questions. Don't overthink them. Then the dorsal body cavity. It consists of the cranial cavity and the vertebral cavity. Cranial cavity is your brain case, all right? That's where your brain is. Vertebral contains your spinal cord, all right? Let's zoom in on the dorsal body cavity. It's located near the dorsal surface of the body. Has two subdivisions, as we just pointed out. The cranial cavity, which is formed by the bones of the skull, it contains the brain. Contains the brain. And the vertebral cavity, formed by the vertebral column, that's another word that you'll now need to know, contains your spinal cord, all right? Now, the dorsal body cavity, the entire dorsal body cavity, is lined by 3 layers of protective tissue called the meninges. You may have heard that word before. There are 3 meninges: the dura mater, the arachnoid mater, and the pia mater. Now, you don't have to know those for your first exam, but you will have to know them for your third exam. In my opinion, you might as well learn them now. Anybody know mater? Some people say mater. I don't care. I never care about pronunciation. Just spell it correctly. I work with people in labs from all over the world, and believe me, people from other places pronounce things differently. As long as you can communicate and spell things correctly, you're in good shape. So mater, as I say, means mother. Dura mater, dura means tough. So what's the dura mater? The tough mother. The tough mama. That's the outermost layer. It is very tough. Then the arachnoid mater. What's arachnoid? Yeah, spiders. It's the spider mother. And then the pia mater is the gentle mother. It's the innermost layer. You may know that it's possible to get an inflammation of the meninges. And here's another suffix I think you really should get to know. Inflammation, itis. Whenever you see itis, that means inflammation. So what would inflammation of the meninges be? That would be meningitis. What do you think? Is meningitis serious or not very serious? Yeah, meningitis is extremely serious. People die from meningitis. People lose body parts. They end up with amputations from meningitis. It's extremely serious. We'll talk a lot more about the meninges when we get to the nervous system. Let's then zoom in on the ventral body cavity, located near the ventral surface of the body. 2 subdivisions: the thoracic cavity above the diaphragm, the abdominopelvic below the diaphragm. And again, there are all the subcavities within. I'm not going to go through those again. We just went through them. You do need to know them. Now, how do you know where the thoracic cavity starts and stops and ends and where the abdominopelvic cavity begins? It's the diaphragm. The diaphragm is the large dome-shaped muscle used in breathing. You can see in the middle on the bottom there the picture of the diaphragm. It's underneath your rib cage. The diaphragm is a large muscle. When it contracts, it pulls on your lungs. It literally pulls air into your lungs. And then when it relaxes, it returns to its normal shape and it pushes the air back out. That's how you breathe, all right? And keep in mind, I'm not talking about the diaphragm in the lower right. Some of you might know about that. That's a different kind of diaphragm. We don't talk about that until Bio 202 when we do the reproductive system. So the thoracic cavity, we're now zooming in on the subcavities. 2 pleural cavities and the mediastinum, which once again contains the pericardial. So in the bottom right, you can see there a nice diagram. Really, the mediastinum itself has more subcomponents to it. The anterior mediastinum, the middle, the superior, posterior. You don't have to know those for me, not for this class, but you do have to know in general mediastinum, okay? Pleural cavities enclose the lungs. Pericardial cavity encloses the heart, all right? So, and the abdominopelvic cavity contains abdominal and pelvic. There's actually not a hard dividing line between abdominal and pelvic. We'll get to that in a few minutes here. So zooming in now on the mediastinum. Again, just to try to take the mystery out of this, there's nothing, it's not a big deal. It's the space in between your sternum and your vertebral column that's in between your 2 lungs. And it's where your heart is. And there are some other major things inside of there. We'll take a look here in just a moment. So, broad median partition between the lungs extends from the sternum to the vertebral column. It contains your heart, which again is enclosed in its own special little bag called the pericardial cavity. The great vessels include the largest artery in your body here, your aorta, and the largest veins, your vena cava. The thymus, which is a gland right above the sternum, your trachea, your windpipe, your esophagus, the tube that the food goes down. So in other words, all the thoracic organs except your lungs are contained within the mediastinum. All right? So nothing special there, just that middle cavity within the thoracic cavity. Finishing up here with the abdominopelvic cavity. Viscera of the abdominal cavity. So viscera, wait, what? What did you say? Viscera. Viscera means organs. If you watch like Game of Thrones, somebody takes a sword and slices somebody down the middle, you eviscerate someone. Eviscerate, E means out. So eviscerate means to cut them so that their organs come out. So get used to that. Viscera means organs. So what are the viscera of your abdominal cavity? Well, some of the main ones are the stomach, the liver, the gallbladder, the pancreas, the spleen, the small intestine, and most of the large intestine. I expect you to know that. You should know which organs are enclosed within your abdominal cavity. Pelvic cavity, again, there's not a firm dividing line here. It's mostly done just by the organs. So the urinary bladder, portions of the large intestine, and the internal male and female reproductive organs. So internal male reproductive organs are things that maybe you know about, maybe you don't. The prostate, for example, would be one. Female reproductive, vagina, uterus, fallopian tubes, now called the uterine tubes. Those would be viscera of the pelvic cavity. Now, the body cavities are lined with membranes called serosa. Think about it. Imagine taking your two forearms and rubbing them together vigorously. What's going to happen? Yeah, they're going to turn red and get sore and inflamed and rough and chapped. So friction is an enemy of your internal organs. And think about all the moving around you do during the day, reaching to pick something up, bending over, standing up, sitting down. Your internal organs are constantly rubbing against one another, and you don't want to get friction burns on your internal organs. So as a result, there are these slippery membranes called serous membranes that line both the organ and the body cavity. There are two layers of serosa. So the parietal serosa lines the wall of the body cavity. The visceral serosa cover the internal organs, which are your viscera. One way I think about this sometimes is imagine each one of your organs is enclosed within a little sandwich bag, and then all the sandwich bags are inside of a big garbage bag. The sandwich bags would be the visceral serosa. The garbage bag would be the parietal serosa. So look in the lower right. You can see the two, what cavities would those be enclosing the lungs? Those would be the pleural cavities. So notice, look on the lung. See the layer that's furthest in, that dark pink? That's actual lung tissue. Notice that the flap that goes right on the lung tissue is the visceral pleura. That's the layer of the serous membrane that actually comes into contact with your viscera, in this case, your lung. Then there's a space. You can see they kind of shadowed it there. There's a space. And then finally you have the parietal pleura, which is the membrane that lines the cavity itself. So we'll see this over and over again. There's the parietal layer, then there's a space in between, then there's the visceral layer. Now that space in between is filled with a slippery fluid, basically like WD-40, so that the organs can move around and not get friction burns. So the parietal pleura line the cavity of the pleural cavity, and the visceral pleura line the lungs themselves. The pericardium lines the heart, the cavity of the heart, the pericardial cavity, and the visceral pericardium is actually on the heart muscle itself. And the last one, and this is a really important one, the peritoneum. The peritoneum, the parietal and visceral peritoneum, line your abdominal cavity and your individual abdominal organs. So in the upper left, you can see a sagittal view of your abdominal cavity. See, there's a liver on the top, then you can see stomach and pancreas, large intestine, small intestine. See how there's a line that goes around, a dark line that goes around each individual organ? That would be the visceral peritoneum. And then notice there's a dark line that goes around the entire cavity. That is the parietal peritoneum. And in between the two is the peritoneal cavity. That's a big deal when we get to Bio 202. For example, an infection in your peritoneal cavity, peritonitis, would cause the inflammation that would be caused, is extremely serious. It can be life-threatening. Sometimes that happens with people who get umbilical piercings. You get an infection in your peritoneal cavity. Why is it so serious? Well, look where it's going to go. Once an infection gets into your peritoneal cavity, it goes to all of your abdominal organs. You can go from having a irritated red belly button to being in ICU within about 24 hours if you're not careful. Peritoneal infections are incredibly serious. So just to try to make this a little clearer, I put in this slide. I'm not going to go through it myself. You should read through this on your own. This tries to explain the serosa, the visceral and the pericardial layers, all right? Go over that on your own. We need to know about body organs. One thing you have to know, I can't believe how many times sometimes I get to Bio 202 and I have people who don't know which side of the body the stomach is on, or the spleen, or the liver, and that can't be. I'm not going to let you continue in this class if you don't know where your organs are. You have to know that starting today, and you have to know that every day for the remainder of your life, okay? Get to know the relative locations of the major organs. I'm so frustrated when people don't know that. I will like make fun of you and ridicule you, and you don't want that to happen, even though you don't care about me. Liver and gallbladder are on the right side of the abdominal cavity, the bottom of the rib cage. Liver on the right. In boxing, that's a left hook to the body. This is the liver punch. I had a girl in my class a few years back who's a professional boxer. She fights like in the ring, you know, on TV in Las Vegas and stuff. And she said she actually got put on the canvas with a liver punch. I was a boxer in college. Let me tell you, you get hit in the liver, you're going down. You can put somebody on the canvas. You don't have to knock them out with a head punch. You can put people on the canvas with a body punch. And that liver punch, again, when you're facing someone, your left hand obviously corresponds to the right side of their body. So left hook to the body, favorite way to put somebody on the canvas with a liver punch. Stomach and spleen are on the left. So the stomach is more anterior, the spleen is way back there, right? Spleen, we don't really talk about much in Bio 201. It's a place where it's a blood reservoir. It's part of your lymphatic system. It also filters the blood looking for bad guys. And then the small intestines are directly behind your umbilicus, okay? Make sure to know your internal organs. I'll ask you that on exams and on quizzes, all right? And then here, a simple way of talking about portions of the abdominal pelvic cavity. We divide it up into quadrants. Quad, 4, all right? So take your umbilicus, all right, and draw a cross section through that. Draw, horizontal and vertical line, all right? Create an intersection there. So we have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. I mean, they're named pretty easily, aren't they? What's big and red and eats rocks? A big red rock eater, all right? What do Martin Luther King and Christopher Columbus have in common? They were both born on holidays. So this is just an easy way, for example, at intake in the emergency room. Let's say you come in and you got this pain. You say, oh, it hurts. And the nurse says, show me where it hurts. And then she writes down the chart, pain in right lower quadrant. So then what's going to happen is she's going to take that and give it to the physician. The physician will see that. And by the time the physician sees you, they already have an idea of what might be wrong. What do you suppose they might suspect if you had severe pain in your right lower quadrant? Yeah, appendicitis. What about pain in your right upper quadrant? Maybe gallstones, okay? Just a simple way of categorizing. It's not hard. You should know these. Here we go. Have you been following along? Do you know your cavities? Let's find out. Which statement is false? The pleural cavities are enclosed in the mediastinum. The pelvic cavity is enclosed in the ventral cavity. The mediastinum is enclosed in the thoracic cavity. The vertebral cavity is enclosed in the dorsal cavity. Or the pericardial cavity is enclosed in the thoracic cavity. 4 of those are true, 1 of those is false. Pause the video. Form your answer. Yes, that's false. The pleural cavities are on opposite sides of the mediastinum. They're separate cavities. So remember, those are all within the ventral cavity, all within the thoracic cavity. But the 2 pleural cavities are lateral to the mediastinum. All right? And here I am in the Valley of the Gods. This is a great place. I usually camp here for a couple nights each year. Awesome. Don't really see anybody here. That pickup truck, I don't think they're going anywhere. Nice view, though. What a great place. Okay, that takes care of that. I'll see you in the next annotated PowerPoint.